Hello, this is Professor Lou with Carolina University, and I'm giving a lecture today called The Human Body and Nutrition. So we could spend a lot of time talking about the anatomy and physiology of the human body, but we can't really cover all of the wonderful aspects of the human body in this class. So what we're going to do is focus on the nutritional perspective. And to do that, we're going to focus on digestion and absorption. So you're going to learn more about digestion and absorption in this class, and then we will understand that there are other body processes and other body systems that are very important as well, but these are the ones that are most relevant to a nutrition class. So first of all, let's talk about the elegant system that is digestion and absorption. Before we even start eating, this process begins. So you're going to have stimuli, and then you're going to have responses to that stimuli. So let's give some examples of stimuli. First, we have the cognitive stimuli. That's things like thinking about food. If I'm getting hungry and I start thinking about food, my body's going to respond. If you have a sound associated with food or hearing a description of food, then that can be a stimuli. What about the appearance of food? If you see food, then that can cause your body to have a response. You can also have a smell or an odor associated with food, and that can be a stimulus. You might say, it smells so good out here when you're passing by somewhere that's cooking food, and your body may respond. You can also have a tactile or taste response. Once you're tasting food, there's actually things that happen in your body in response to that taste or the feeling of food in your mouth. So what are the responses? First, we have thermogenesis. So we have an increase in heat production. The salivary glands will start to increase saliva flow, and there'll be changes in the saliva composition as well in preparation. Then the cardiovascular system will also change. You can have an increased heart rate and blood flow and a decreased cardiac output and stroke volume. So it actually changes how our heart beats. The gastrointestinal tract will have changes, including increased acid and digestive enzyme secretion, motility, gut hormone release. These things are taking place in preparation. Then we have the pancreas. The pancreas will have increased digestive enzyme secretions and hormone release, such as insulin. The kidney system or renal system has alterations in urine volume and osmolarity in response to these stimuli. So when we talk about the gastrointestinal tract, or you'll hear GI tract, occasionally you'll even hear alimentary canal. You don't need to know that word, but that's another word for the gastrointestinal or GI tract. This GI tract is the connected series of organs and structures used for digestion of food and absorption of nutrients, all right? And within the GI tract, there are important organs that food actually travels through, and then there are other organs that are helping along the way. We're going to see that on another slide. Here's your GI tract with all of the major sections of it labeled with their function. So the mouth is where we chew food and it mixes with saliva. The salivary glands produce saliva, which contains a starch digesting enzyme called salivary amylase. And then we have the pharynx, which swallows the chewed food mixed with saliva, and that's called a bolus, and that bolus travels down what's called the esophagus. The esophagus helps to move that bolus to the stomach. Then we have stomach, which mixes and churns food with gastric juice that contains acid, hydrochloric acid, and a protein digesting enzyme called pepsin, creating what is called chyme. So chyme is the name of all that churned up protein digesting. The protein is getting digested by the enzyme pepsin. All of that mixed together with that acid, that is called chyme. Then we have the liver, which makes bile, and that aids in digestion and absorption of fat. So when we talk about fat, we'll talk more about bile. And then the pancreas releases bicarbonate to neutralize the intestinal contents, which, it's very acidic up till that point. And it also produces enzymes that digest carbohydrate, protein, and fat. The gallbladder, this is an organ I want you to remember what it does. It stores bile and releases it into the small intestine when needed. The small intestine digests food and absorbs nutrients into the blood or the lymph. We're going to see that the small intestine is the place that is most involved with the absorption of nutrients. Then we have the large intestine, which absorbs water and some vitamins and minerals, and it's the home of the intestinal bacteria, and it passes waste material along. Then we have the anus, which opens to allow waste to leave the body. So, with the digestive tract, we have certain organs that are involved in ingestion, like the mouth and the esophagus. Then we have other organs that are involved in digestion and absorption, like the stomach, the small intestine, and the large intestine. And we have organs that are involved in elimination, like the rectum and the anus. Then we have assisting organs, like the salivary glands, the liver, the gallbladder, the pancreas. So the assisting organs never actually contain the food. They just help with the process of digestion. The ones for ingestion, absorption, and elimination do contain the food. The food actually passes through them. Okay, so as we have movement through the GI tract, we're going to describe parts of that right now. The lumen is the interior of the gut through which food travels. So the food is traveling along the lumen. And how does it do that? It does that through a process called peristalsis. Peristalsis is the longitudinal, lengthwise muscles that relax while the circular muscles contract and pushes the bolus ahead, okay? I like to think of this as a tube of toothpaste, and the peristalsis is like the squeezing of the tube in toothpaste, but it's actually a little more complex than that because you have these longitudinal lengthwise muscles relaxing at the same time as the circular muscles contract. I guess it's a little bit like the end of the tube of toothpaste, where you have the longitudinal muscles are kind of like your hand squeezing the tube, and the circular muscles contracting are kind of like the small circular end of the toothpaste tube. And so when all that's happening at one time, then you can see how it pushes it out. So the circular muscles contract, breaking down the chyme into even smaller pieces once it leaves the stomach until the chyme is thoroughly mixed with digestive juices. And this process of peristalsis, though, really does take place throughout the GI tract. It's not just in the stomach area. And then we have sphincters. So sphincters are very interesting. They move things through the GI tract a little bit differently. The sphincter can't or is not supposed to let things go back. It's only supposed to help things go forward. So when it's closed, the sphincter prevents the backflow of material. Typically, it's kind of like a valve where it can't allow things to go backwards, only forwards. And when you have those sphincters in the GI tract along with the peristalsis, then you're going to have a process that really pushes things forward, okay? And then we have elimination. So elimination takes place at the very end of the digestive process. Elimination is the removal of undigested food from the body. So what do the macronutrients break down into? Well, the carbohydrates break down into glucose. The lipids break down into fatty acid and glycerol. And the proteins, this is very important, breaks down into amino acids. Okay? Let's talk about absorption for a minute. This is an illustration of the many processes involved in the lumen of the small intestine. The small intestine is the organ where the most absorption takes place. That's going to be very important to remember. The small intestine, you need to associate that with absorption and the most absorption in the body. And then you have the large intestine, which is the organ that absorbs water and electrolytes. It also forms and stores feces. This is where the gut bacteria live. The ones that we use to help us with digestion, the good ones, they live here in the large intestine. So how do these smaller particles enter into cells? Because that's a process that's taking place in the body. This food is being broken down, and then once it's in these small particles, it is then passed into cells. So how does it do that? So one way it does it is passive diffusion. So passive diffusion, water and water-soluble substances like urea and glycerol and small lipids move with the concentration gradient. So what that means is if you have a cell membrane and you have a whole bunch of things on one side and very few of them on the other side, passive diffusion will move with the concentration gradient, okay? So the particles that are on the side where there's a whole lot of particles just like them, they're going to move through the tube-shaped transmembrane protein channel into the side that there's fewer of them. And that's a passive diffusion process, okay? Moves with the gradient passively. Then we have facilitated diffusion. So in facilitated diffusion, a transmembrane protein carrier actually changes shape to facilitate entry and exit of some nutrients. This is an example of when this takes place is fructose. So you're still having a movement from higher to lower gradient, but there's this transmembrane protein carrier changing shape to facilitate that happening. That's facilitated diffusion. And then we have active transport. So active transport is different because it requires energy. So minerals, some sugars, and most amino acids move against a concentration gradient for this to take place. It's active and it's moving against the gradient. That's one reason it requires energy. You have to have the input of energy to do this. And then we have endocytosis. So in endocytosis, the cell membrane surrounds small molecules and engulfs them, actually surrounds them, takes them in. And if you look at that word endocytosis, it looks like exactly what it is, the taking in and surrounding of a small molecule. Okay, so let's just mention some other body systems real quick. We've got the vascular system, the lymph system, the nervous system, the hormonal system, and the immune system. And all of these have a little section in this chapter in the book. And so I would encourage you to look at those if you've never had an anatomy and physiology class. We're not going to focus on these other systems so much because we're focusing on digestion and absorption, but they all are important body systems and related to nutrition in some way because everything's really related to nutrition because we have to eat in order for our body to function. And all of these systems could not do well and survive and do what they're supposed to do if we did not have the absorption taking place. And the absorption can't take place unless we have digestion, okay? So just mentioning that these other body systems are in your book. There's a little section on each one, and I would encourage you to look at that if you are not familiar. All right, so this is back to the digestive system, just another slide with this illustration showing the system that we're really focusing on, which is the digestive tract. So what influences absorption? Absorption can be influenced by many, many things. And these are the three categories of those things. We've got psychological influences. Did you know your psychology can influence how you digest and absorb food? Well, it can. The taste and smell and presentation of food can have a positive effect on digestion. Just the thought of food can trigger saliva production and peristalsis. Stressful emotions such as depression and fear and anxiety can have the reverse effect and actually make it harder to digest and absorb food. They stimulate the brain to activate the autonomic nervous system, and the autonomic nervous system will cause things in our body that make us slow down. The results can be decreased gastric acid secretions and reduced propulsion of food, inhibition of peristalsis, reduction of blood flow to the stomach. All of this slows things down. So let's say we have a positive memory and happy thoughts when we're at a holiday meal, and the smells of the family's traditional foods are wafting through the air, and this is the experience we're having right before we eat. Those things are positive psychological influences, and they would help us digest the holiday meal. But if, on the other hand, we were very stressed and upset, then we would have the opposite effect, where those stress and upset feelings would actually cause us to not be able to absorb and digest the food as well. Then we have chemical influences. So the type of protein you eat and the way it's prepared can have an effect on digestion. So protein is one of the things we're going to focus on when we're talking about chemical influences. Plant proteins tend to be less digestible than animal proteins, and also cooking food usually denatures proteins. It kind of uncoils them, and that makes them more digestible. Cooking meat often softens the connective tissue that meat is made out of. It makes chewing easier and increases the ability of digestive enzymes to break down the meat into absorbable nutrients. So that is something to remember with chemical influences, is that cooking can help the process along. Food processing can have an influence on how we digest, can influence digestive secretions, those chemicals. For example, meat extracts may stimulate digestion. Frying foods in a fat at very high temperature produces small amounts of something called acrolein. And see, this acrolein is a chemical that decreases the flow of digestive secretions. So when we have that, it will actually decrease our ability to digest and absorb. So the physical condition of food sometimes causes problems with digestion. For example, cold foods may cause the intestines to spasm. Now, it's usually not a huge problem because the food has to move through the GI tract and it may warm up along the way because our body temperature is warmer. But the cold foods, it does have a effect on our body. When food is consumed on an empty stomach, it has more contact with the gastric secretions and will be absorbed faster than when it's absorbed on a full stomach, so that can have an impact. Certain medicines can affect our food absorption. For example, the medication Reglan, which is a drug that treats heartburn, increases GI motility, which decreases food absorption. So people on Reglan will actually absorb their food less well. In turn, certain foods can enhance, delay, or decrease drug absorption, and that's why on your medication bottles from the pharmacy, it'll often tell you whether or not to have this drug with food or not. That's one of the reasons they tell you that, because sometimes it has to do with this process of enhancing, delaying, or decreasing drug absorption depending on when you take it. And last, we have the bacterial influences. So the bacterial influences are very important. In a healthy stomach, there's hydrochloric acid that kills most bacteria. And in conditions where there's a lower concentration of hydrochloric acid, more bacteria can survive and multiply. Harmful bacteria can cause gastritis, which is like an inflammation of the stomach lining. It can even cause a peptic ulcer, which is a wound in the mucous membrane lining of the stomach. So bacteria can cause foodborne illnesses as well, and those can resist the germicidal effects of the hydrochloric acid, and so they can survive and really wreak havoc with the digestive process. And most of the foodborne illnesses, when we're thinking about foodborne illnesses, they have some ability to resist this, or they would often be destroyed, but they are not destroyed, and so that's one reason they are pathological to humans. So the large intestine maintains a large population of bacteria that are considered good bacteria, and they have various functions that we talked about a little bit earlier, but one of the things they do is that they digest small amounts of fiber, and that actually produces a small amount of energy for us, so that's one reason we consider them good bacteria. These bacteria can synthesize gases such as hydrogen, ammonia, and methane, as well as acids and various substances that contribute to the odor of feces. The methane particularly contributes the odor to gas. If the digestion and absorption of food in the small intestine is incomplete, the undigested material enters the large intestine, where the bacteria action produces excessive gas and possibly bloating and pain. So that's one reason sometimes people are having gas. All right. So stress management can actually help with our GI system. So it's important to remember that when we're under stress, we may have changes in our GI system, and reducing that stress or trying to help ourselves cope with that stress will usually help our GI system. And some of that is based on what happens with the psychological influences, and that everything can be influenced by our psychological state. So some of these chemical influences can be influenced by our psychology. All right, so let's talk about the GI ailments. Now, some of them are made worse by psychological factors, and so we'll discuss that as we go along. But the first one we're going to talk about is heartburn. Now, heartburn is a problem that can occur. Most of the time, people know what heartburn feels like by the time they're, young adults, probably, maybe middle-aged adults for sure, because people experience it commonly. However, if people have it more often, on a regular basis, a couple of times a week or something like that, then that's chronic, and that would be considered GERD, or gastroesophageal reflux disease. Again, that's gastroesophageal reflux disease. And so GERD is a problem where this very happens often now. It's heartburn too. Heartburn is this too. But GERD is when it happens often. When the lower esophageal sphincter relaxes to allow stomach acid to flow into the unprotected esophagus, because the stomach is prepared for acids. Acids live there all the time. Acids are in there all the time. And the stomach is made for that. But the esophagus is not. So when the stomach acid flows back up or flows into the esophagus, it's not prepared to have acid in it, and that's when people get heartburn and it hurts. So with GERD, lifestyle choices can make a difference in how people feel and how much they experience it. So usually people are told, you need to change your lifestyle in order to treat this. And one of the ways they tell them to do that is to change their diet, because there are certain foods that are more likely to cause heartburn and contribute to gastroesophageal reflux disease. Some of those are chocolate, peppermint, fatty foods, coffee, and alcoholic beverages. Alcoholic beverages, you will see, cause quite a few problems with the GI tract. And we're going to have a section where we talk about alcohol kind of in depth, because there's some important things about that lately. And so you'll hear more about the potential harms that it can cause. All right, so back to GERD. You can have GERD more often if you're overweight. So sometimes people are told if they're obese that they can lose weight and impact their GERD symptoms positively, and that works for them if they do that. Some people will try to elevate the head of the bed, because if you are laying down, especially if you have recently eaten, then the acid can more easily get through that sphincter where it's not supposed to get through the sphincter, but it does. It can happen more easily. And so if you have a little bit of an elevation, like a wedge pillow, then that will actually help to decrease how often that happens. Also, just not lying down after you eat can help, or drink. So these are the things that help to treat GERD. There are medications that help to treat GERD, but the lifestyle factors make a huge difference. Most of the medications that are used for GERD actually decrease the stomach acid. So you can see how that might not be advantageous, because our stomach acid helps us digest, right? So sometimes maybe it would be better if people could use the lifestyle changes. But if those don't work, then the medications that decrease the stomach acid may be necessary and useful and correct, because you don't want the stomach acid to erode the lower part of the esophagus. That would be a big problem. All right, next we have lactase deficiency. So lactase deficiency, if we don't have enough lactase, then we will have trouble with dairy products a lot of times, especially milk. So the lactase deficiency is a lack of an enzyme that helps to digest and break down the lactose, which is a sugar that is in milk products or dairy products. And so when we're very young, most people have enough lactase. It's not a problem. But as we age, some people, and this can vary with genetics, will develop a deficiency of that. And when they do that, they can no longer tolerate dairy well. And so they are said to have lactose intolerance, and they get symptoms when they consume dairy products. They usually have most trouble with milk. Sometimes they can tolerate ice cream. A lot of times they're able to tolerate cheese, but not everyone. So what can they do about this? Well, one of the things they can do is just avoid those foods, but the problem with that is those foods are important to getting enough calcium. So they may do something like this. They may take lactate pills, which are pills that contain the enzyme and help them to break down the food. Or they may have food products that are made for people with lactose intolerance, and the sugar is already broken down a little bit. That lactose is already broken down a little bit. So then they don't have symptoms. They could do that. Or they could have the dairy products that they can tolerate and avoid the ones they can't. So let's say someone has lactose intolerance, they can tolerate yogurt, but they can't tolerate milk. Okay, then they get their calcium from yogurt. So they could do that too. And then maybe if they're going to have some milk, they use that lactate pill before they have the milk. So lactose intolerant, very common problem. And there are solutions to it. Next is constipation. Also a very common problem, more common in women than men just because of anatomy. Women are more likely to get constipated, but everyone experiences it from time to time. Most people know what constipation feels like. So if we're having a problem with constipation, that is infrequent or difficult bowel movements followed by a sensation of incomplete evacuation. So that's defined as having a bowel movement fewer than 3 times a week. With constipation, stools are usually hard, dry, small in size, and difficult to eliminate. People who are constipated may find it painful to have a bowel movement and often experience straining, bloating, and the sensation of a full bowel. Constipation is really a symptom, not a disease. Almost everyone does experience it. There are certain diseases that cause constipation, though, but constipation is really a symptom. All right, so what can we do about constipation? Fiber helps constipation. Having enough fiber in your diet. A diet low in fiber and water and high in fats is a common cause of constipation. Some fibers, such as pectins in fruits and gums in beans, dissolve easily in water and can take on a soft gel-like texture in the intestines. Other fibers, such as cellulose and wheat bran, they pass through unchanged through the intestines. The bulk and soft texture of fiber helps to prevent hard, dry stools that are difficult to pass. People who eat plenty of high fiber foods are not likely to become constipated. People who do not eat enough high fiber foods are much more likely to get constipated. So when we're eating high fiber diet, though, we have to make sure that we're getting enough fluids, because without those fluids, the fiber doesn't help us much. And it actually can cause more problems with constipation when we don't have enough fluids. All right, so caffeine in many liquids, such as coffee, tea, and many soft drinks, is a mild diuretic, a substance that increases urine production. And that kind of runs counter to what we're trying to do here. So avoiding caffeine could actually help with constipation in a kind of indirect way, because it takes more water out, and we need the water. We need that fluid to make our stools soft. So really, constipation's treatment is determined by the cause and the severity and the duration. In most cases, dietary changes help to relieve the symptoms and prevent constipation. Regular exercise can also help prevent constipation. It keeps those muscles healthy. And, I know from my experiences in healthcare, if a patient is laying around in the bed, in the hospital bed, or even at home in bed, they will be much more likely to be constipated. And if they get up and walk, it usually makes a big difference. So you definitely see it practically when you work with people who are constipated. You definitely see that practical solution of walking around helping, particularly when it's combined with fluids and a high fiber diet. All right, next let's talk about diarrhea. Diarrhea is loose, watery stools that occur more than 3 times in one day. that's diarrhea. And the digestive products just basically go through the intestine way too rapidly, and they don't have sufficient time to have water absorbed from them, and that's why the stools are watery. So diarrhea is a symptom of many disorders, and the disorders themselves are causing this increase in peristalsis. Stress, intestinal irritation or damage, side effects of medication, intolerance of gluten, which is a protein in wheat, fat in the diet, and there's like too much fat, and lactose in the diet when people are not able to tolerate it, can cause diarrhea. Eating food contaminated with bacteria or viruses can also cause diarrhea. The body is basically trying to eliminate the offending virus or bacteria by moving things along faster, and getting that virus or bacteria out of the body. So you think of that like food poisoning. Your body is trying to get rid of whatever it has it's taken in that is dangerous. So diarrhea has a risk of dehydration. Dehydration means the body lacks enough fluid to function properly, and dehydration is particularly dangerous in children and in older people. They can get dehydrated more quickly. Little babies can get dehydrated very quickly, and it must be treated promptly to avoid serious health problems because you have to have water to survive. Water is really the most essential nutrient. We can not survive without water. And if we're in a situation where we're not getting nutrients, water's the one that will cause our death the fastest if we don't get it. If we don't get water, and there's other nutrients that we could survive longer, but if we don't get water, we're not going to survive very long at all. So that's an important thing to remember in this class, and you'll see that on a test question, I believe. All right, next we have ulcers. Ulcers are actually wounds in the stomach. So we used to tell people when they got an ulcer that they needed to decrease their stress level and that would fix it. But what we actually found over time in healthcare was that there was a bacteria that was associated with ulcers, and this bacteria was causing many, many of them. The bacteria is called H. pylori. So now we test for H. pylori when someone has the symptoms of an ulcer, and if their test is positive, we actually give them medication to kill that bacteria. Another cause of ulcers is NSAIDs, which are non-steroidal anti-inflammatory drugs. They're very commonly used. They're things like aspirin, ibuprofen, naproxen sodium. These drugs are hard on the stomach. And if we consume them regularly, especially if we consume them when we don't have any food in our stomach or we haven't had any milk or something that coats the stomach like that, then we are much more likely to get an ulcer. So that can be a cause of ulcers. But if you feel you have symptoms of an ulcer, it's important to have an evaluation so you can get that H. pylori test. And if you're going to use NSAIDs, they're actually very safe in many ways, and they help us with things like headaches, menstrual cramps, and aches and pains, and muscle soreness. It's not that you can't take them, as long as you have not had an ulcer before and no one's told you can't take them, then you should definitely try to take them with food, though, to decrease the risk of ulcer. All right, next is diverticulosis. So diverticulosis is caused by the high pressure in the intestine that's associated with constipation, and it actually causes an outpouching in the intestine. So let's describe that a little bit more formally. Diverticulosis, is a condition that occurs when the small pouches, which are called diverticula, push outward through weak spots in the colon, okay? So once that happens, you have these little pouches, right? And you can get diverticulitis. Diverticulitis. Now, in healthcare and medicine, itis means infection or inflammation. So diverticulitis is a condition that occurs when small pouches in the colon, called diverticula, become infected or irritated, okay? It usually causes pain on the left side of the abdomen, and Often these things have to be treated too with maybe antibiotics if it's an infection to try to clear that up. So diverticulitis and diverticulosis are much more common in industrialized countries, particularly the United States, England, and Australia, where low fiber diets are very common. And diverticular disease is quite rare in Asia and Africa, where people eat a high fiber, vegetable based diet. So you can see that the risk factor there is this diet being consumed in the United States, England, and Australia, and other places similar that has a similar low fiber diet. That's really a risk factor for this diverticulosis and diverticulitis. All right, let's talk about irritable bowel syndrome next. Irritable bowel syndrome is a problem for 10 to 15% of adults in the US. That's a lot of people. And it is a disruptive state of intestinal motility with no known cause. Symptoms include constipation, abdominal pain, and episodic diarrhea. All right, so people that get diagnosed with IBS or irritable bowel syndrome have often had the whole GI workup. So they've complained of symptoms, they've gone to the medical care, and they've had the tests. And the tests all come back that everything looks normal. They've scoped and looked at everything, and the mucosa and the inside of the intestinal tract looks normal and fine. They didn't find any evidence of autoimmune diseases like Crohn's disease or ulcerative colitis. They didn't find any cancer or any blockages that would explain what's happening. And so they diagnosed them with irritable bowel syndrome, and which is a functional problem where for unknown reasons, there's a disruption in the intestinal motility. Now, people with IBS can have constipation. They can have diarrhea, so that most of the time they're constipated, or most of the time they have diarrhea, or they can actually have alternating constipation and diarrhea, but they never feel like they're normal, but they have one or the other kind of all the time. So what can be done about IBS? Well, honestly, we don't know what causes it, and we're not very good at treating it yet. But there is some good news. The symptoms can be uncomfortable, but they don't shorten the lifespan or progress to more serious illnesses. So that is good. IBS can usually be controlled with diet and lifestyle modifications, as well as judicious use of medication. We do have some medications at this point that we can use. A diet strategy referred to as FODMAP is a strategy that is used. It has been decreasing symptoms in some people with IBS. The short-chain carbohydrates are incompletely absorbed in the GI tract and can easily be fermented by gut bacteria. And so people on this FODMAP diet will consume less of foods that will be most likely to ferment by the gut bacteria. They're going to eat less of those, and that will decrease their symptoms. The fermentation and osmosis caused by the undigested sugars are likely the cause of symptoms in many people that have IBS, and that causes gas, pain, and diarrhea. So when they eliminate those foods from the diet, they usually get some relief. Stress management can also help people with IBS because their symptoms are often exacerbated by stress. This includes a reduction of stress and then also training to help with relaxation therapies, meditation. Maybe they could go to counseling, get some support. Regular exercise can help decrease stress and decrease their symptoms. Also, changing stressful situations in their life and getting adequate sleep. Those can help with IBS. But it is, it is good to know that it does not progress into serious GI problems like cancer or anything like that. All right. Then lastly, we have colon cancer. So colon cancer is a serious disease that does cause a large number of deaths in the United States and in most other places in the world. Colorectal cancer. It occurs in the colon or the rectum, and it's the second leading cause of cancer-related death in the U.S. Many studies suggest that consuming large amounts of red or processed meats, along with low intake of fiber and protective phytochemicals that help us to not get cancer, things from fruits and vegetables. There's certain chemicals in fruits and vegetables and whole grains that help us not get cancer. And so when we don't consume any of those, and we consume a lot of these red or processed meats, and we don't have a good fiber intake, then that can make us at risk for colorectal cancer. But honestly, we don't know everything about what causes colorectal cancer yet. These are correlations. It's important to recognize, however, that other dietary factors and also just the Western lifestyle in general, like a high intake of sugars and alcohol and low intake of fruits and vegetables, and behaviors like low physical activity and high smoking prevalence and high body mass index, just really puts us at risk for this. You can't really isolate it to just meat consumption or anything like that. So the link between colorectal cancer and consumption of cooked and processed red meats is attributed to chemical carcinogens that arise from the cooking process. But you have to take into account, too, that meat is the easiest way for us to get protein that we really desperately need. So you have to balance all these ideas in making your food choices. All right. So colorectal cancer, one thing to remember about colorectal cancer is it can be caught early and you can survive it much easier if it's caught early. It can be very, very curable. And one of the things that we recommend for colorectal cancer screenings is that people get a colonoscopy. The recommended age keeps getting lower. I think it's in the 40s now. I think it's about 45. That you're supposed to get a colonoscopy. And if your colonoscopy is normal, then you don't have to get one for 10 more years. So you get one at 45 and then 55, and that one's normal 65. If they find problems, though, then they'll have you to get the colonoscopies more often. But there are little polyps that develop in the colon, and some of those polyps will become cancer. And so when you have a colonoscopy, they can get rid of those polyps, they can take it off, and then that one will never develop cancer. So that's one reason to have a colonoscopy. Also, they can catch cancers in an earlier state if there is a cancer present. So colonoscopy has been very, very useful to help people catch colon cancer early and prevent colon cancer by getting rid of those polyps. So it's recommended. Now, if there are a few people that just absolutely will not get a colonoscopy, they just refuse to do it. And if they do, there's some new tests. One thing, you can test for blood in the stool. That's not very specific, but it can tell you that someone needs to do more testing. And then there's also some tests of like the genetic material that's present in stool, and those can help to find colon cancer sooner also. So there's probably new things on the horizon that we're going to see going forward. But right now, colonoscopy is the gold standard to diagnose and also prevent, through the elimination of polyps, colon cancer. All right, so that's one of the cancer screening tests highly recommended, especially if you have a history of colon cancer in your family, then that would be recommended even earlier and more often. Okay. All right, so let's talk about the benefits of fiber. We've touched on the benefits of fiber a couple times already. Fiber can help us maintain a healthy weight. It can help us with blood sugar control because the fiber slows down the sugar being absorbed into the bloodstream, which helps us control our blood sugar level. We have less heart disease when we consume a high fiber diet. It helps us to not absorb some of the things in our blood that would otherwise build up in our arteries. It helps to just take those out instead of letting them build up in the vessel walls. And we have less constipation when we have a high fiber diet, and we have less diverticulosis and therefore less diverticulitis. Let's talk for a minute about high fiber diets and how difficult it is to get enough fiber. This is a food label that I pulled off the Walmart website. So this is Nature's Own bread. It's advertised as 100% whole grain bread, okay? And it's all wheat, but how much fiber does it really have? I actually like Nature's Own. I eat it. And I think that I'm getting fiber, and I am getting more fiber than if I had the white bread probably. But how much fiber am I really getting? Assume that a person is having a 2,000 calorie diet. And the daily value for fiber for them is 31 grams, okay? Which is what it is for males. I think it's males, like young males. Males like 30, let's say a 30-year-old male. That's what his daily value of fiber would be. Find a percent daily value for this bread, okay? How much of the fiber that you need every day is this bread going to give you? All right? So you take the 2 grams of fiber because it says dietary fiber 2 grams. See that? Dietary fiber 2 grams. Okay? You take that 2 grams right there per slice and you divide it by 31 grams of daily value. Okay? And what do you get? If you do that, you get 0.06, which is 6%. And you can see the food label tells you 6% right there. 6%. Well, if you ate 2 of them, that's 12%. And that's all you got from 2 slices of bread on your sandwich at lunch. Only 12% of the fiber you need. Wow, not that much, right? You're going to need a lot more fiber than that to reach 31 grams. And that's why it's so hard to get daily fiber that you need, because we just don't eat a lot of foods that have enough fiber in it to get there. To get to 31 grams is really hard. But fiber is wonderful for our GI tract. It helps prevent constipation. It decreases the risk of many chronic diseases. And so getting enough fiber is very, very important. And there are breads that you could find that you might enjoy that had more fiber in it. So next time you go down the bread aisle, if you're looking to increase your fiber, or next time you go down the cereal aisle, if you're looking to increase your fiber, look for things that are high fiber, low sugar, and low fat, and see if those things can help you reach your fiber content while also maintaining your other goals for your health. Thank you.